Felicia, does reimburse hospitals and physicians for care given. So it is based on a reimbursement of care given. It is not a gift. It is not something that is shared with hospitals just to do whatever they want to. It is based on hospitals doing the work and submitting that bill.
And thank you for clearing that up, because I certainly didn't mean to imply
No, that's not true with all tax systems, but it is.
Oh.
The Housing Authority receives its money through property taxes. And at a time like this where we have so many foreclosures and reduction in the taxes because of the value of the homes, I'm wondering how this ultimately is going to affect that as well. So this bill does help us. It helps at a time when we are artificially affected by an economy that is not doing well. And the homeowners are taking the brunt of this, not the businesses. The businesses are to some extent, the small businesses, but the homeowners definitely are. And so to the extent that they are paying into that hospital authority, it relieves them.
Anybody else? No, I'll go ahead and move on. This is kind of an interesting question. As an employed surgeon of the hospital, so I guess you would be the employed surgeon, not that you practice this type of medicine, but how would it save myself or my insurance company money to have a simple breast biopsy done, for example, if it can be offered as a procedure outside of the hospital?
I'm not sure I understand the question.
I'm not sure I understand it.
The fact whether I'm employed or not, I was in private practice for most of my career, and then recently decided to be employed because I couldn't, frankly, afford the overhead. I've never been sued, and my malpractice is $60,000 a year. I've been in practice 13 years. I've never been sued. In terms of what I do what I do, whether I'm in private practice or whether I'm in the hospital. I do want the cost of the care to go down, but I take care of plenty of people who don't have insurance. And my concern is I want patients to get excellent care. Breast cancer in particular is a very, very common thing, and I'm a big proponent of breast cancer, both because it's what I do and I have family members with it, but the cost of breast cancer care is going up. People need breast MRIs. We never used to do MRIs. We do a $100 mammogram. A breast MRI costs $6,000. Whether we like it or not, whether the patient has insurance or not, she's going to need that. Whether they do the biopsy in the hospital or as an outpatient, sometimes it costs less to do it as an outpatient. Sometimes it costs more to do it in the hospital. It's not just the biopsy, though. It's all the care. It's the Herceptin that we talked about, which isn't paid for in England or Canada. It's the MRI. So if the biopsy could be done cheaper as an outpatient, in an outpatient facility, we should do it. I don't quite know what else to say about that question.
Healthcare is a significant part of our economy. I think, Felicia, you were saying that's $12.6 trillion component. That's not a dirty word, by the way. This is not something that is necessarily inappropriate. We're talking about an industry and a part of our economy that is multiplying jobs, benefits. It is an economic engine. A hospital is not only a business, but it's also a community benefit. Hospitals need to be in business in order to be a benefit to a community. There is definitely an inappropriate usage at times of our emergency departments and various services, but when you need it, you definitely want it there. You want qualified people who can see you immediately. You want to have equipment that's up to date, that is state of the art. You don't want to be in a hospital in your community that is way behind in technology or training or equipment. So why would it be important for a hospital to provide provide service that oftentimes is provided in another setting, perhaps an ambulatory surgery center or an imaging center or some such. And there is competition, definitely competition out there, and I think it's good. It promotes quality improvement, it promotes innovation and creation of jobs and creativity. So it is important for hospitals to have some business lines that provide an income for it, so that today, as we know, there is a drop in income because of the uninsurance that comes to it by law. By law, we are not able to turn someone away from the hospital when they come to the emergency department. We have to treat. We have to see that patient. So there is a burden there, and what happens is a hospital becomes essentially the IRS. The hospital becomes a taxing entity itself. It takes care of one segment by taxing another group, and it's a fairly indelicate way of stating it, but that's essentially what happens.
That's kind of interesting, because that leads into this next question. Why do people without health insurance, such as myself, pay far more for the doctor or any other services within the hospital or medical facility than Medicare or insurance companies? They oftentimes get 20 to 50% discounts or more. So why can't people paying cash for their own care receive the same kind of financial treatment?
Well, I think that goes back to, you want to talk about it?
I can answer.
All right, go ahead.
The simple answer is that insurance companies and Medicare have enormous negotiating power, and you as a single fee-for-service patient do not. Therefore, you're not going to receive the same discounts because they have no reason to offer them. There really isn't any simpler way to put it than that.
Anybody else?
You can, though, petition the hospital for the reduction in fees if you know how to do it.
Okay. Joe, you want to share that methodology? It's a small group.
It's a state secret, so don't tell anybody, all right? Essentially, you are either uninsured, underinsured, or insured in some mechanism. If you're uninsured, the hospital has a duty in order to keep its doors open to try and collect money. And if you are able to document that you have no resources, yes, there is a process that we provide for charity or a reduction in required payments. So yes, there is definitely a way to do it.
Okay, thank you.
Using taxing authority that you discussed earlier.
Okay, let me move on to the next question. I cannot work, and I'm just above medical assistance, the required cutoff amount for medical assistance. I cannot afford insurance. What services and diagnostics and or treatments are available to me at age 60? Does that mean there is none, or?
For a woman, per se, there's American Cancer Society funds for screening mammograms available, reduced or completely paid for. I know that. In terms of other stuff, it's very difficult. I mean, unfortunately, this is a tragic part of the population, and this is a need that has to be filled.
Thank you. I have another question. I'm trying to work through these. We're going to stop questions at 8:30, and then I'll ask the panel for their assistance in something else. But how will the proposed healthcare reform